views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hey everybody, I'm the Dr. Bob Lee and welcome to Open BxRx, our special coverage of COVID-19, also known as the coronavirus, and how it's impacting the Bronx community and beyond. Coming up on today's show, as unemployment rises, with many workers getting sick, we're here from a group of volunteers working to provide services to people to get through this time. Plus, we'll take a look at some numbers of who is being most impacted by COVID-19 and why the Bronx is getting hit hard. And it's been made mandatory to wear a mask outside. We'll talk to a community group working to distribute masks at no cost. After that, public schools in New York City will remain closed for the rest of the school year, and we will get tips on how to keep kids healthy while staying home. Then Bobby C has the latest on the impact of COVID-19 in the world of sports. And then later on, we'll learn about a virtual event with information on the health and environmental impact of cycling. So stay tuned. All this and more is headed your way. We are now open. Welcome back. Our next guest is the Executive Director of Volunteers of Legal Services, and he joined us to discuss their work in response to COVID-19. We welcome Marcia Levy to the show. Marcia, welcome.
Thank you. It's really nice to be here. I appreciate you having me.
Yes. Tell us everything that you're doing.
We're doing so much, and it's overwhelming, but I will have to say that we're thrilled to be able to have the expertise to be able to represent low-income New Yorkers who are facing tremendous difficulties, as we all know, during COVID-19. It might be helpful just to tell you about VOLS in general, and then I'll drill down on some of the specific work we're doing. VOLS was formed 35 years ago, actually at a time of crisis when there were many cuts to legal services, and we got formed to help to make a connection between legal service and the many lawyers who wanted to volunteer their time to give back to the community and to use their expertise to represent people. Fast forward 35 years, and we have a staff of 19 experts, lawyers and legal staff who help low-income immigrants, small business owners, elderly, veterans, incarcerated mothers. We also work with unemployed workers as well. And we've just launched a hotline actually for unemployed workers because we all see that, there's a pandemic just in that area as well. And so we're taking calls, and I know that you're going to share our hotline information from people for everything from starting the process of working in unemployment to representation once there are hearings.
Tell us about your COVID-19 response work.
So the COVID-19 response work, there's, again, our regular work, you might say, is pandemic work, because of course we know that
started during a situation.
Right, and also that poverty and low-income people face myriad legal issues all the time. But our specific work to COVID, again, is relaunching our unemployed workers project. We're working with many of the large law firms so that when we get a call, not only can we give the help, but we can multiply the impact by getting large law firms and companies to have their lawyers volunteer with our clients. We also are, we're also working with elderly and veterans. You could imagine that they're such a group that is so poorly, so badly impacted by this, and to do life planning with them is really critical as people, we're all thinking about issues of, health and mortality. And it's important to have the paperwork in place to be able to know who's going to make decisions about your health. what's going to happen with your belongings. I want to tell you, actually, if you don't mind, about a new life planning project that we
Sure.
have. And that is our healthcare and frontline worker project.
Yes.
And that project is specifically geared towards exactly that, healthcare workers and frontline workers. That could be anybody working in the medical facilities and medical fields. And what we want to do is, we know it's a difficult topic, but we know that they're working about their own health and their own life planning. And we're there to provide free help. We have a form, it's online, and we are working with, again, law firms and companies that are happy to provide their services for free. So we hope you'll let your constituents know that that exists.
Yeah, and this is something that a lot of people are reluctant to talking about, where am I going after? And, how do I set that up? And they really don't do it. A lot of people don't do it to the last minute, but a lot of people do, but a lot of people don't want to think about it.
Of course, it's a very difficult topic.
Yeah, but this is something, this pandemic is making people say, hey, wait a minute, I have to think about this, because I can be here today and gone tomorrow. Just like that. I mean, we see it all over the news. It's right in front of us.
Right. And it's important. I think it gives people peace of mind to know that they have thought about it. Gives us all a little more control, but also keeping in mind that it's also about who's going to take care of you if you're sick, who's going to make decisions. And that alone is a real critical piece. So again, we want to make that available. And, there are so many people, we have to do a shout out. It's not just the doctors and the nurses. It's also people who work in the hospitals, people who do deliveries, people who are serving the food, who are cleaning up. All of those people we consider, and that's why we said healthcare and frontline, because we feel like you're all on the front line.
Well, you have to give us your information so that the people can find out what to do. This is the time.
It is really the time. And the last thing I just want to say, in addition, again, immigrants we know are facing even more difficult issues, fear, as well, about seeking help, and we hope they will, and we'll call our hotline, especially anyone out there who is looking at DACA renewal during 2020. We are working fast and furious to get people renewed, because we don't know, the Supreme Court of the United States is going to be issuing a decision on that anytime between now and June, and we want to make sure that people have renewed their documents or created documents so that they are in the best position to stay in this country. These are hardworking people who are, many restaurant workers we're seeing lose their jobs, and we want to be there. So I know you're going to share hotline information, and I hope that people call us.
We'll
and
put it
finally,
up for you.
Thank you. And I just want to say one other thing, because, this will cover all the areas, and I know I'm speaking quickly to get it all in there. And we love the Bronx, by the way. We do a lot of work in the Bronx. We work with a number. Our model is to work with over 210 community organizations where, so we're up there. And even though I'm a girl from Brooklyn, I love the Bronx. My late husband, my late husband was a Bronx boy and went to DeWitt Clinton, and we know it well. But also we work with incarcerated mothers, and you can imagine at this time, nobody is able to visit. They can't visit their children. Phone calls are very difficult. Their circumstances of living in close quarters, using phones that other people have used, not enough cleaning supplies or soap. We really want to do a shout out to that group of people, to the children of incarcerated, knowing they're home from school and they can't talk to their parents to help them with their schoolwork, even incarcerated parents.
Same thing with the hospitals. You can't visit or talk to your loved ones. Sometimes the nurse will let you do a FaceTime, but, a lot of times, no.
Absolutely. And so, really important to think about the programs, the wonderful programs that serve, that group of people, including us. We help with legal work on family law matters relating to their relationship with their children. So just to say, in all of those areas, if you know somebody, an immigrant, someone incarcerated, a small business, a healthcare worker, someone unemployed, please have them call Volunteers of Legal Service, also known as VOLS, and we're really, really happy to help.
There you go. Thank you so much. Marcia Levy, Director of Volunteers of Legal Services. We love you and thank you for all the work that you do.
And thank you for what you're doing.
Yes.
Appreciate it. Bye-bye.
Stay safe, stay healthy. We love you.
Thank you.
We'll take a break, and we've got more next. Hey, welcome back. I'm the Dr. Bob Lee. You know, the Bronx View Community is presenting Free Mask Fridays. It's an event distributing masks to the community. And joining us with all the details, we have Anthony Welch. He's the COO. Welcome. How are you?
Thank you so much, Dr. Bob Lee, for having me.
So tell us, your mission is to provide creative and educational resources to children and young adults living in the homeless shelters. Is that so?
Yes, that is correct. Yeah.
Tell us about it.
So I started the whole idea of giving back when I first started collecting clothes for the homeless about 2.5 years ago.
Yeah.
I went to different boroughs of the Bronx. Different areas of New York City. Yeah. I traveled to even Staten Island, New Jersey, and just started to collect clothes. You know, I had no goal in sight. It was just to collect clothes, use my own gas money, pay for tolls. And then in return, I got a lot of feedback from people very intrigued with what I was doing. Yeah. I gave those clothes into the shelters. I built a relationship with the shelters from there. And then people just got engaged and wanted to know what more can I do, you know, and that's why I formed Bronx View Community.
Yeah. When did you start it?
So I started doing community work in 2017. The official start was in late 2018. And
you've been thinking about it for a long time.
Almost 5 to 10
years. Go too.
You
said, let me travel throughout the 5 boroughs. Let me have, let me open this up to the 5 boroughs and grab as much as we can so I can give back the way I want to.
Exactly. And people were actually made fun of it as it was a fun thing to do, you know. It was exciting as people were anticipating me coming in like a Santa Claus and just, giving a little light to people. Yeah.
And Anthony, it turned into a real thing.
Yeah.
Now look, we're in a pandemic here, COVID-19 pandemic, and you're giving back in a very, very special way. Talk about Free Mask Fridays.
Yeah, so I was home the other day and in quarantine, like a lot of individuals are right now, and I was just thinking, I need to find a way to give back to my community, but at the same time, do it in a safe and proper way.
I'm glad you created an outlet because some people are going crazy. I got to get out of here. But yeah, you found an outlet.
Trust me, I've been watching reruns for the last couple of days.
I know that's right.
Yeah, so we did that. I thought about the idea and what a safe way to get back to the community. So I thought about face masks. And one of the things I did was connect with a local vendor within the area who's currently, she was a fashion designer, but now she does face masks.
Yeah.
And I told her about the idea to get back, and she was like, totally just jumped on it, wanted to do it right away. So I said, you know what, let's do a free face mask. And then I thought, how can I do it in an effective way where I don't prevent crowd congestion? So I said, let's do a pop-up style. So the day of Free Face Mask Fridays, which is a bi-weekly event, we're not going to reveal the location of where we're going to be until the day of.
Yeah.
This way we don't have any promotion where there's lines formed, things of that nature. And the places that we pick is going to be unique and random. People just have to keep their eyes open to see where we end up next,
Yeah.
Yeah.
And I'm sure these are going to be very, very helpful because, you still see a lot of people out there without masks. And it's very much needed. I mean, if you're coughing, you would want a mask to capture that. Somebody else is coughing down the block and the wind is blowing. This thing is so contagious that we have to wear masks and sometimes even wear glasses or goggles. I see people out there with the whole gear and I'm like, whoa,
yeah,
this is some serious stuff.
It is. I mean, PPEs, personal protective equipment, is so vital right now.
You learned about that, huh?
Yeah.
So for a while, you were saying, what the heck is a PPE? So let me look this up. Say it again. And you hear somebody else say, PPE, all right, personal protection equipment.
Exactly. I think all these terms is going to be stuck in our head for years.
Oh my God.
Yeah. So I did my research on that, and I realized how in minority communities how we suffer the most, So I just wanted to give back. The way I started this organization was giving back, and the way I want to tackle COVID-19 is giving back.
So we have to just look out for a location where are you going to put it up a day before? Where are you going to put it up? You said you put it up a day before.
Yeah. So what we're going to do, we're going to put up a few places. We're going to put up on our social media platform, which is Instagram, Twitter. That'll be Bronx View Community.
Yeah.
Website will be bronxviewcommunity.org. And you can find all the information. And we're also looking for donations. If there's any businesses or any individuals that want to donate, you could just check out our website, bronxviewcommunity.org, and you can find a way to donate.
Yeah, go ahead. Ask for it. Ask for it again. Go ahead.
Yeah, so the official website is www.bronxviewcommunity.org. You can find a way to donate if you're an individual, if you're a business. We are looking for support. And if you want to look for social media, it'll be Instagram, Bronx View Community, Twitter, Bronx View Community as well.
Yeah, and who's working with you?
Also, my co-founder, Aaliyah, she's working with me.
Hey, Aaliyah.
Yeah, Aaliyah is actually out in the field right now doing some community work as well.
Be careful out there, Aaliyah.
Yeah. So we're also working with her name is London. She works in the Westchester area. She lives in the Westchester, and her brand is Dope Sophies. It's a very unique clothing brand. Definitely look out for it. And she decided to do face masks right now. And she's getting a lot of feedback from the community. But I just want to say thank you to BronxNet for giving me this platform. You guys have always been so generous to capture local organizations doing things for the community. So the platform you guys have is just amazing. Yeah.
Well, thank you so much, Anthony, and good luck with all that you're doing and giving out those masks. You're helping other people get what they need out of life. And I always know that that's important. That's what we do. That's what I like to do. And you're right there, man. God bless you. Stay safe and stay indoors as long as you can. Okay.
Thank you so much, Dr. Lee. Same to you too as well.
Anthony Welch and Aaliyah Marbury.
Yes.
She's the CEO. She's a COO and you're the CEO.
Yes.
Bronx View Community. Thank you guys so much.
Thank you, Dr. Lee.
All right. I'll see you soon.
Stay
safe.
Bye.
All right. We'll take a break. I've got more open next. Welcome back. I'm the Doc, Bob Lee. The Bronx has been hit hard with COVID-19. And joining us with information on the health in our borough, we have Charmaine Ruddock. She's the project director for Bronx Health Reach. Welcome, Charmaine.
Thank you, Bob. It's good to be with you.
Isn't it? These are unusual times. Tell us about some of the things that you're going through right now, being quarantined and all that.
Mm-hmm. Yeah. New York City being the epicenter with our stay-at-home executive order by the governor. I've been home. I've kind of even lost track. I think this may be our 5th or 6th week sheltering in place, but still working extremely long hours. It feels as if I'm working even longer than when I was actually in the office.
Exactly. At least you got a chance to get out and get some fresh air, right? But
exactly,
we have to do right now.
Exactly.
So
I actually miss going up and down subway steps, if you can believe it.
That was your exercise for the day, huh?
That was my exercise, yes.
Yeah.
Uh-huh.
Now you got to find some steps, even if there's 2, and just go up and down those steps.
Or just do high stepping inside.
Yeah, you know how to do it.
Mm-hmm. Mm-hmm.
So tell us about the impact of COVID-19 on the borough of the Bronx.
So by every reporting, the New York is the epicenter of COVID-19, and the epicenter is the Bronx. It has the highest per capita rate of COVID-19 cases and deaths.
Yes.
As of April 19th or 20th, the Bronx had 1,962 cases per 1,000 people. That was leading. It's, you know, we've been working so hard trying to publicize the fact that the Bronx is 62 out of 62 in the state in terms of health outcomes, and we've always wanted to be first. We never wanted to be first, though, with the COVID-19 pandemic. But here we are, dishearteningly so, but not surprisingly so.
So being number 19, do you think that's one of the reasons why the Bronx has been hit so hard?
Being number 62, you mean?
62,
Absolutely.
being number 62.
It should not be a surprise to anyone. It should not be a surprise to our leadership. It should not be a surprise to policymakers. It should not be a surprise to healthcare providers. And I'm sure it's not a surprise to Bronx residents. When you're in the Bronx that has New York State's worst rates of asthma, hypertension, obesity, diabetes, then why would we not have the worst rates in terms of COVID-19? There's so many things that, you know, when they talk about the risk factors, the things I just listed are the health risk factors, but the socio risk factors are also very much prevalent here. When you talk about crowded housing, right? When you talk about pollution in our atmosphere, when you talk about people can't get access to quality, healthy food, when you talk about people being poor and therefore they are taking jobs that are on the front line, they cannot shelter at home because they're the ones that are delivering food, working in the groceries and the bodegas, being out there, having to be in the very midst of how you can contract the virus, then it's not surprising that we are the epicenter of the disparity in COVID-19.
Yeah. So it's been really, really bad. I mean, has it hit certain groups more so than others?
Of course it has. So we have the geographic distribution of COVID-19 cases, right? But we know we are seeing now data on the disparate impact on racial and ethnic groups. And so the disparate impact is on African Americans and Latinos. The Bronx is the borough, that's the only borough where the majority of people are Black and brown, are Black Americans and Latinos. So yes, geographically and racially, we are bearing the burden of this.
Yeah. So this has just put a bigger magnifying glass on the whole thing. I mean, everything involved that's contributing to this. COVID-19 is just a big magnifying glass. It does
put a big magnifying glass. I've been saying it puts a spotlight on it. But again, I'm concerned when I hear people our leadership who should know better, sort of be surprised themselves. The Bronx Health Reach has been part of an action group. Once we got the report from the Robert Wood Johnson County Health Rankings report about 6 years ago, Bronx Health Reach, Montefiore Health Center, the New York City Health Department, even the borough president, we came together and we formed something called Not 62, the Campaign for a Healthy Bronx.
Yes, I remember that.
Mm-hmm.
Yes.
Exactly, and we've been working diligently to bring this to the attention of our leadership. We were glad to have a sit-down meeting with the mayor towards the end of November, and we had a meeting with the borough president to say, hey, what is being done to address the fact that we are consistently showing so badly in terms of health outcomes, and there's such a huge disparity between where the Bronx is and where the other boroughs are, and what's the plan to address it? I mean, we in our meeting with the mayor, we said, you know what, basically you're talking about we should be putting together a Marshall Plan for the Bronx in order to shift the Bronx from being last in health outcomes every single year. And even before Robert Wood Johnson, it should not be a surprise because the rates of the health issues have been so poor for the Bronx.
Yeah. So what do you have in mind now? Do you have like a picture of where this should go or how people should act or react to COVID-19?
Mm-hmm. So I think there are a number of sort of points that we should talk about. Right now, there should be, more testing. We're not seeing enough testing happen in the Bronx. We have heard about opening up test sites in some of the high hit areas. We understand there's some testing site being opened up in Harlem. There's some testing sites being opened up in Brooklyn, around the central Brooklyn area.
Oh.
We need to see something similar happen in the Bronx with more testing sites. We also need to see there is concern in terms of people, going into the emergency room because they're showing symptoms, but they're being turned back because they sort of haven't had the symptom of the shortness of breath. But then they go home and they're quarantined and they are experiencing the whole thing. So one of the things that we're encouraging people to do, I know the Institute for Family Health, which leads the Bronx Health Reach coalition, has set up telehealth. If people go to the institute.org, they will see the telehealth connection that they can check there. So there's that. And then one of the things Baba, I'm really glad to speak to you, is there's some myths going around that we really want to expose and say to folks, hey, well, one of the myths that has been going around, not just in the Bronx, but in several circles, is that Black people can't get COVID-19. Clearly, the rates at which Black people and Latinos are getting COVID-19 and are dying from it should dispel that myth. You can get it, right? Yeah. We also understand, we know that the mayor and the governor have issued guidelines. Well, actually, they've issued orders that we should be following, the 7 feet social distancing, the other thing, the wearing the mask. Well, there is some real concern and legitimate concern amongst many young African-American Latino men that them wearing a mask in a society, in a community where they have been so exposed to racial profiling that they're like, no, we're not going to wear a mask. And that will make us even more vulnerable to the police coming up to us. Wow. And so one of the things we'd like to urge the mayor, as he's talking, and the NYPD, is to do some targeted messaging to our young Black and brown men about why the wearing masks will not make them more susceptible to be racially profiled, and some clear guidance from the mayor that if any incidents of racial profiling by the NYPD of young Black and brown men will be dealt with severely. I think there needs to be that encouragement and that messaging that goes out into our community to help them adhere
Charmaine,
to the requirements.
Yeah, Charmaine, you have a lot of great information. Do you have a website where people can go and find out more about what you're talking about?
If you go to BronxHealthReach.org, you will find out all our information. As well as, please, I'm encouraging people who feel that they need to see the doctor but may not have access to a doctor. Please go to the institute.org and connect through our telehealth.
Thank you so much, Charmaine. Your wealth of information, and come back again, okay?
Very good. Thank you, Bob,
Share
for
more.
giving me this opportunity. Thank you.
Stay safe, and
Okay.
God bless you.
You too. Stay safe. Thank you. Bye-bye.
Charmaine Ruddock, Project Director, Bronx Health Reach. We'll take a break. We'll be back with more on Open.
Joined now by the multi-talented, multi-versatile Brandon Scoop B. Robinson. Brandon, how are you?
Man, I'm doing good. How are you?
Looking good, man. Life is challenging right now, but, managing.
It's all about the versatility, like you say.
You have this amazing resume with your career pretty much taking so many different turns right now. Senior writer at theheavy.com. You also have Scoopy Radio. I could see you got a brand new backdrop for us and been doing a lot of things, especially on socials. Tell us a little bit about what you've been able to accomplish right now with all of your different avenues for doing sports, especially basketball.
Scoopy Radio has been making it entertaining in the last month. During the pandemic, we've had NBA Hall of Famers Shaquille O'Neal and Isaiah Thomas on the Scoopy Radio podcast. We had Stephon Marbury last week, and in between, we've been doing a lot of interviews with NBA legends. Michael Jordan and the Chicago Bulls' documentary, The Last Dance, began airing episodes 1 and 2 this past Sunday. We had Scott Burrell, a member of that Bulls team, on this podcast, and we've just been discussing just various things going all the way forwards, all the way backs, twists and turns. But that's been pretty much my bread and butter right now. I spoke with Jason Caffey, a member of that Bulls team, today actually, and we just discussed his recollections of his time with the Bulls, and just what he thinks of the documentary versus what's been going on. So you'll be checking out columns about that via heavy.com, but just staying busy and finding ways to be creative.
Now, that interview with Stephon Marbury really got a lot of traction, especially on social media. Some heavy hitters in the business commenting about some of the remarks that Marbury made. And Stephon made, I think, the great remark that should be made, in my opinion, because of how I feel about him as a player. But he thinks Michael Jordan's in a class by himself. And maybe Marbury is the right guy to comment because he's someone that played during an era and was able to play with a lot of those legends from that time period, including Kobe Bryant and LeBron James.
What was really interesting about the interview with Stephon is we really picked up where we left off from when I was a kid. Started my journey at 12 years old with the Nets back in New Jersey. And I honestly, for real, did not think that the comments about the whole Michael Jordan thing was a big deal. He said that he kind of felt uneasy in Minnesota.
I love playing in Minnesota. It was great. I couldn't give 7 years of my life living in Minnesota. I grew up in New York in a melting pot where it was black, white, Chinese, Puerto Rican, Italian, all different type of races. And when I moved to Minnesota, it was predominantly white. How cold it was like 40 below. You wake up and some days they'll be like, oh, if you go outside and, if you don't have this and this, you can die. Now I'm older, so I can adjust to anything, right? But it was a different thing at 18, 19, 19 years old.
I thought that was the thing was going to move, but the commentary about Jordan and LeBron and Kobe, fits in the stratosphere of the documentary, the Last Dance documentary that's getting ready to start. So, I'm thankful the numbers reflect that on Scoopy Radio for this month, the most listens that we've gotten. Thankful for people, the new listeners, and I'm glad to be on here with you talking hoops.
That's wonderful, and congratulations on that. What were your thoughts on The Last Dance? Did you think it was good?
I enjoyed it for a myriad of reasons. Number one, most people will say it's their childhood. It's in addition to that, when I started my career. I started my career covering the NBA and during the 1997-98 season. I was 12 years old, hosted a show called Net Slinging Planet with Evan Roberts on WFAN and Albert King, New York City legend, brother of Bernard King. And so the thing that kind of stood out to me was actually the section where they discuss Scottie Pippen's role. When I look at Scottie Pippen's situation, it's like, man, there really is nothing new under the sun. He was shooting with Jerry Krause and, felt as though he did not get paid his just due when he inked that 7-year, $18 million deal with the Bulls. This was actually after their first championship in 1991. You look at guys who grew up in the hood who, had some issues where they wanted job security, had never seen money before. I was with Magic Johnson back in February, and he talked about how he still can't walk past the Nike store because Nike offered him maybe not as much money as the major contracts were being offered now, but they offered him a ton of stock options with Nike. And because he didn't know what stocks were, he signed with Converse. We all know the Converse weapons. Could you imagine the Air Magics? It's crazy.
I know it's been asked a million times. I'm sure you've been asked it a million times as well. But do you think Michael Jordan is the greatest of all time?
I fell in love with the game of basketball in 1991. My stepfather's from the west side of Chicago. Literally grew up down the street from the old Chicago Stadium. But to your question, I agree with Stephon Marbury in that Michael Jordan is in a league of his own. With Michael signing with Nike, a retired player recently told me that up until this year, anybody that were Nike clients and wore Air Jordans on the court, Nike fined them. They just changed the rule this year. Nike was so influential that he had certain guys getting fined for wearing his shoes. If there was no Michael, there'd be no Kobe. If there was no Michael and Kobe, there'd be no LeBron James. So, I think Michael is an influential player and arguably the best player. But Bill Russell still has 10 championships and Michael has 6.
I think it's pretty exciting to finally have something to get excited about during this pandemic in terms of watching some fresh content. The Last Dance has been a breath of fresh air.
For sure. We got episode 3 with Dennis Rodman, and you look at episode 4, the dynamics between the Pistons and the Bulls, and the 7 years it took for the Bulls to finally get past Isaiah Thomas and the Detroit Pistons. And that's partially why it was difficult for Michael and Scottie to accept Dennis Rodman within their circle, because Dennis Rodman was part of that Bad Boys era that beat the Bulls. And so there was a level of mistrust. And, so it took a while. So you'll be seeing a lot more of just those dynamics from the 80s transitioning into the early to late 90s as well. It's definitely a good masterpiece. And those who are watching, keep watching. You'll enjoy it.
Scoop, I think it's fair to say 2020 hasn't really been all that great so far. Of course, in the sports world, it kicks off with the passing of Kobe Bryant, and you were someone that had a relationship with Kobe and his dad. Speak a little bit about what it meant to you to watch that news come across the bottom of the screen that Kobe Bryant had passed away.
I was actually on the Lakers the night before he died. I have a good relationship with some of those guys on that team, and was covering the Lakers and the Sixers in Philly the night that LeBron broke his record. LeBron yells in the locker room. He goes, "Yo, we ain't going home tonight. We flying back tomorrow." If the Lakers had flown back that night, LeBron would have never have spoken to Kobe that last time. I felt that to be significant. I actually called Kobe, and the phone just rang. It rang and rang and rang, and I text someone in his family and said, "I don't know what's going on, but I'm praying for you." And about 12 hours later, when everybody knew, the particular person in his family texted me and said thank you. And, we've been kind of communicating back and forth, but it's a significant loss. Kobe, I went to college down the street from Lower Merion High School, and I realized the significance that Kobe had on basketball and just the Philadelphia suburbs. And I spent time with Kobe's dad some years ago in Texas at a basketball exposure program. Our hotel rooms were right across the hall from each other, and I get where Kobe gets his footwork from. Jelly has incredible footwork even at his age, and I miss Kobe, man. Kobe was a good dude. Made time for me during my career, and he's definitely a miss.
Scoop, I appreciate you taking some time to talk about transcendent stars. I know you're a transcendent star in this business of sports media. Where can people follow you? And where, I know this week you got a whole bunch of Laker legends coming on the show. Tell us a little bit about what's coming up.
Yeah, so we had Kareem Rush Monday on the Scoopy Radio podcast. We talked about the 2004 NBA Finals between the Pistons and the Lakers. And then we got Lauren Jones, who covers the Los Angeles Lakers, talking about the current day Lakers. And then on Thursday, we have John Celestin, who for an hour, we talk about Shaq and Kobe's feud. That may be hitting some headlines later this week. So please be in tune with that. We also talk about Ron Harper, who left the Bulls and came to the Lakers with Phil Jackson. So a lot of different storylines there. I'm excited.
Enjoy The Last Dance, Scoop. Thanks for coming on the show.
My brother, thank you for the opportunity.
Always cool to catch up with you.
Welcome back. I'm the Dr. Bob Lee, and our next guest is the CEO of Action for Kids, for Healthy Kids. And he joins us with a look at their work towards kids' health during this COVID-19 pandemic. We welcome you, Rob. Rob, welcome you to the show. Rob Bisceglie, how are you?
It's great to be here. I'm doing well. How about you?
I'm trying to hang in there. Are you stuck in the house there?
Stuck in the house in the suburbs of Chicago, like a lot of folks out there, dealing with kids and working all at the same time. But we're making our way through it.
Yeah, I mean, after all of this being held up in the house and everything, how are we going to get out of the house? We're going to eat ourselves. We're not going to be able to fit through the front door.
Well, I think it's really important to be healthy, especially at this point in time. So I think that's really critical.
Tell us about the healthy things that you're doing with the youngsters.
Yeah, well, like a lot of people, like you said, stuck at home with the kids. So my wife and I are trying to do double duty, both doing our jobs and being teachers for our kids. So we're trying to take it as seriously as we can. We're trying to schedule our day, making sure that we have things to do in the morning and in the afternoon so that our kids can experience some structure. I think that's really important.
And when we get back into
all parents.
Yeah, and when we get back into school, I'm sure you're going to give the teacher a lot more than just an apple, huh?
Oh my gosh.
You know what it is.
Those our teachers, and I should say it's not even just our teachers, but it's our school staff altogether, food service professionals and others. They're doing what can only be called heroic work, right?
Yeah.
And so one of the things I wanted to say is that my heart goes out to all the folks who have been impacted by COVID-19. And I've just been so impressed by how our communities have responded in really big ways, including the folks in schools.
Yeah. Talk about some of the things that you're doing.
Yeah, well, we at Action for Healthy Kids, we for many years have worked on physical activity, nutrition programming, social emotional well-being, and really providing both schools and parents all kinds of tools that they can use in order to make sure that kids are healthy. And our basic philosophy is schools can't do it alone, teachers cannot do it alone, parents can't do it alone, but together we can make real progress. And the stories I could tell you about what I've seen over the last 12 years as I've been at Action for Healthy Kids.
Yeah. I hope. You've been there for 12 years.
12 years.
Tell us one story that stands out in your mind.
Yeah, I can tell you a story from very early on. It was I think it was in my first year, and I visited a school in Chicago, and a brand new PE teacher came out onto the playground, and it was a young gentleman who just graduated from school, and I remember talking to him out on the playground, and I remember the tears welling up in his eyes because he was telling me, and it really is unbelievable. And it still happens to this day. I hear stories like this even after 12 years. He was telling me that he didn't have enough balls for the kids on the playground so that every child could have a basketball.
Yeah.
To teach them all at the same time. And I remember how grateful he was. We do grants at Action for Healthy Kids to help schools with equipment like PE equipment and others. And I remember how grateful he was that he was going to have a basketball for every child on the court, and the change in his demeanor when those balls were brought out to the kids. And, he started thinking about what he could do now that he had a little bit of equipment. And so I could tell you stories until, until the end of the day.
Yeah.
But it's really fantastic.
You need about an hour or so, right?
Indeed.
Little campfire. Outdoors, of course.
Right.
Yeah. What would you tell parents? I mean, parents are working hard. They're working double duty. They're at home. They're the teacher. They're the parents, and they're doing a lot of other work that they wouldn't have done while they were out working.
I should say is, number one, I feel your pain. I feel fortunate. I happen to have a circumstance on my end where we can get through it. But I have 3 kids who are school age in elementary, middle, and high school. So I'm experiencing it along with a lot of other people. I think what parents really can do these days are 2 things. Number one, I think perhaps most importantly, some parents may not realize the extent to which they are role models for kids.
Yeah.
So you don't have to tell kids what they have to do. You have to show them what they can do.
Yeah.
So family walks, cooking with the family, getting involved in their education, STEM classes, math, and all those other kinds of things. Just to be actively involved in the day. There are so many challenges that we're going through right now, but there are a few things that are happening where there might be a little bit of a silver lining. Where parents are actually getting involved in some things that we hadn't been as much involved as maybe we should be.
A little more bonding going on.
Yeah, go ahead.
A little more bonding going on, yeah.
There is a lot more bonding, and it's really wonderful in a lot of ways. Of course, there's so much tragedy out there, too. I don't want to minimize that at all. But let's take advantage of the opportunities that we have. Show kids how to live a healthy life, how to connect with each other in different ways, support their social and emotional well-being. Oh my gosh, is that so critical? They can't go out with their friends. They can't go to school and see their teachers. So we have to show them what it means to connect with other people. And in this case, it's really connecting with the rest of the family.
This is a unique tight walking balance that we're doing right now, because there is something out there that's very negative, but we have to stay positive to keep our sanity. And sometimes if you got a bunch of screaming kids, you said from elementary, junior high, and high school,
it's tough.
God bless you.
Yeah. The second thing, of course, parents can do is someday we are going to go back to school.
Yeah.
There's no doubt about it. We are going to make it through this. So in the coming months, for a lot of kids, it's going to be for the next school year. In the coming months, kids are going to go back to school, and parents need to be involved with schools as well.
Yeah.
Not everybody can volunteer every day or anything like that. That's not what I'm saying, not what I expect. But getting involved in school is critical. And in fact, if you read the research, it is proven that the extent to which a parent is involved in his or her child's education, has a huge impact on the accomplishments of that child. So it's really important.
I agree. So this is the prerequisite for going back and enrolling and becoming fully matriculated somewhere. Or you can just pick up a book and read it and keep knowledgeable as to what's going on and around you. It makes you want to do something. This is a time during times of like this. A lot of people have invented a lot of great things, over the years. So this is one of those times. So we'll be looking forward to one of your inventions.
Yeah, we got a couple of things we're working on.
You're working
actually.
on it?
Yeah, well, I could tell you about them. So we, as soon as this happened to us and we started to see how it was going to impact kids, we knew that we had to do something about it. And so we had actually brought the kids, talked to our school partners. We've got about 55,000 schools across the country, about 150,000 people, parents, and other volunteers in our network. We started surveying them and talking to them. And
that's great.
what really came out of it was we knew kids were going to be hungry.
Yeah.
They rely on school foods. And so we have a program right now that we're rolling out for emergency feeding kits for schools so that they can have the coolers and insulated bags and other equipment that they need in order to help kids. And it's not just kids these days, it's entire families that schools are feeding. And so it's really crucial work that we're doing.
Tell us, what are you doing in Chicago?
Yeah, we do all kinds of things. I was going to say, by the way, when we reached out to our school partners, one of our big school partners is New York. So I want to give a shout out to our friends in the New York schools. We know they're doing fantastic work. Here in Chicago, it's our hometown. So we're one of the strategic partners along with Chicago Public Schools. And in Chicago, what we do is we test out a lot of the things in Chicago that end up being pushed out around the rest of the country. Excellent. So Chicagoland is a fantastic place for us. We work with tons of schools, lots of parents and families, and it's really, really work that is so inspiring.
We love the work that you're doing. Is there a website that people can go to find out more?
actionforhealthykids.org.
We have an attitude of gratitude. Yeah. CEO Action for Healthy Kids, Rob Bisceglie. Thank you so much for joining us, okay?
Thank you so much for having me.
Stay healthy, and good luck, and be safe.
You be safe too. Thanks so much.
Take care. Bye-bye. All right, we'll take a break and come back with more Open right after this. Welcome back, everybody. Our next guest is the founder and principal of Urban Cycling Solutions. Yes, indeed. And he joins us with information on their work and upcoming training. We welcome Dan Suraci to the show. Dan, how are you? Good morning. Good afternoon. Good evening.
I'm doing great in social isolation.
Yeah, there you go. We have to do it, man. We have to do it. So tell us about the training that provides expert instruction on active transportation and complete streets concepts, including tools and policy implementation. Tell us about it.
Sure. So, I'm really excited to be working with the Bronx Health Reach to bring this training to the Bronx. This is a training that's funded by the New York State Department of Health, and the intent is to help communities learn about strategies to increase public health outcomes, mobility outcomes, and environmental outcomes. Yeah. And, when people hear complete streets, they often think of, things like bike lanes and speed bumps, and those are definitely tools that we use, but ultimately complete streets are more broadly about designing streets for people of all ages and abilities that facilitate, business development, economic development, and just get people enjoying the places they live in a safe way.
Does it make it easier to cross the streets? How is that done?
Absolutely. So there's a lot of different ways you can do that. Generally speaking, when you see some of the intersections we have in the Bronx, I think about the Grand Concourse. One of the obvious challenges we have is that these are very, very wide crossings, which is great for cars, but at a human scale, wider crossings are a little intimidating, and they're kind of hard to navigate as pedestrians. So one of the things that we can do
over there. It's like Queens Boulevard.
Exactly.
Yeah.
Exactly. So one of the things that we can do, and you've seen this all over other parts of the city, is put in curb extensions or pedestrian plazas that narrow the traffic lane, make the crossing shorter, and theoretically slow down cars as they approach that narrowed crosswalk.
Yeah. Do you get any opposition?
Well, certainly I think people who, less than 30% of people who drive in New York City, certainly are afraid of these things. But, data tells us that, sure, you can slow things down a bit, but that doesn't mean that you're necessarily holding things up. Traffic moves more efficiently.
Yeah. And it has the safety issues attached to it, too. So that's a good thing.
Exactly.
Yeah.
Exactly.
You got older people and children going to and from school that have a rough time crossing that Grand Concourse over there.
Exactly. And that's what it's about, really. Where do your kids play? What park do they go to? Where do your kids go to school? We want to make sure that there are safe, accessible paths to those locations.
Yeah, Dan, you have an event coming up?
Yeah, we are conducting an online training. It's about an hour and a half, and we are going to be talking about all these things. We're going to talk about how Complete Streets has impacts on public health, how we can increase business activity by implementing some of these treatments and policy measures, and how you ultimately get these things implemented with New York City DOT.
What can people expect to learn?
Well, I think they can learn a variety of things. First and foremost, introducing these concepts and understanding how they can be applied in their neighborhood. But also, it's one thing just to recognize issues with your street, but another thing entirely to be able to say, hey, here are 4 or 5 solutions that I think could work in my community. Here are tools and resources that the city has that I think we could apply here, like a neighborhood slow zone. Those are the things that we want people to come away from this training with.
In that slow zone, do you create speed bumps also?
Yeah, so neighborhood slow zones are a program through New York City DOT that neighborhoods can apply for. And basically, there's a variety of treatments where the speed limit is reduced. There are speed bumps and signage at certain areas.
Yeah.
It's a really great program.
Thank you so much. Urban Cycling Solutions. Dan Suraci, Complete Streets. Thank you so much. And nice talking to you. Stay safe.
All right, you too.
Okay, talk to you soon. Bye-bye. All right, we'll take a break. More Open on the way next. Wow, funny how time flies when you're having fun. Unfortunately, that's all the time we have for today's show, and I want to thank our guests and you, our viewers, for tuning in and checking it all out. I want to thank you very much for letting us share in this space and time with you. You can continue following BronxNet for our continued coverage. Always remember this: what you are is God's gift to you, and what you make of yourself is your gift to God. So choose your choice. Let your choice control the chooser. I'm the Dr. Bob Lee. I'll catch you up at 107.5 WBLS. Stay home, stay safe, be blessed. We love you all. Peace.